Assisted living is saving Medicare and Medicaid billions each year, offering a better quality of life and delivering care in a setting older adults actually want to live in. So, why is it still underfunded, misunderstood, and overlooked in long-term care policy? I just got back from Capitol Hill with Argentum, and trust me, this conversation is heating up.
Welcome to Breaking Ground, Senior Living Now, a From Leads to Leases special edition by CCR Growth. In these fast episodes, we cut through the noise to bring you urgent updates, hot takes, and industry shifts as they happen. Let's get into it.
March 12th and 13th, I was in DC on Capitol Hill for Argentum's Public Policy Institute and fly-in, standing with hundreds of operators and executives from across the country, pushing for one thing: recognition and support for assisted living. Let's be clear, assisted living isn't a luxury. It's a vital part of our long-term care system. It supports over 1.4 million older adults in more than 31,000 communities across the U.S. These aren't facilities, they're homes, offering dignity, connection, and real care for some of the most vulnerable in our senior population. Here's the problem, though. Despite overwhelming demand and rock-solid data, assisted living is often left out of the policy conversation. And if we look at the numbers, the average assisted living resident is 85 years old and managing multiple chronic conditions. 90% report high satisfaction with their care. 99% feel safe in their communities, safer than they did living alone at home. And on a cost level, assisted living averages $64,000 per year. Compare that to over $116,000 for a private room in a nursing home. We're talking about a cost-effective, high-impact solution to long-term care. And yet, here's what's broken. Number one, misaligned public policy. Let's start with the elephant in the room. Our long-term care funding structure is outdated and not built for the reality we're living in. Right now, Medicare and Medicaid fund over 60% of long-term care costs nationwide, but very little of that is flowing into assisted living. In fact, assisted living is overwhelmingly private pay, with only around 20% of residents receiving Medicaid support. And even that is limited through restrictive waiver programs that many states cap or underfund. Most families have to deplete their assets, sell homes, or drain retirement accounts just to afford care. This would be less of an issue if assisted living wasn't already doing the government's job for less. A 2021 study found that assisted living saves Medicaid an estimated $43 billion a year, simply by keeping older adults out of more expensive care environments like hospitals or skilled nursing facilities. And yet we're not seeing public investment match the value we're delivering. So what's the takeaway? We're rewarding higher cost care settings while ignoring the more affordable, higher satisfaction model. That's not just a policy blind spot, it's a missed opportunity to stretch public dollars further while providing better outcomes for older adults. So what are we waiting for? Second, we need more units fast. This isn't just a demand trend, it's a demographic tidal wave. Every day, more than 10,000 Americans turn 65, and by 2030, all baby boomers will be in retirement age. The population of 85 plus, which is the average assisted living resident, is projected to more than double by 2040. And yet, we're way behind on development. NIC estimates we'll need 880,000 new units of assisted living by 2030 to meet demand, and that translates to over $1 trillion in development costs by 2050. So the problem is we're not building fast enough, and we're not building smart. In 2024, new assisted living construction hit the lowest level since tracking began. Red tape, slow permitting, zoning obstacles, and lack of investment incentives are making it harder and more expensive to bring new supply online. Some communities report waiting 12 to 24 months just to break ground, even in areas with clear demand. This lag is pushing us toward a supply cliff, and the longer we wait, the more we'll see rising prices, limited access, and overburdened care settings. So we need better financing tools, faster approvals, and federal and state level incentives to stimulate development, especially in underserved markets. And lastly, number three, the caregiver shortage is real. Even if we build the units, we still need people to staff them. Right now, we're facing a historic workforce crisis in senior care. 400,000 caregiver roles are already unfilled today across the long-term care spectrum. And by 2040, we'll need 20 million workers in long-term care just to keep up with demand. This includes home health aides, CNAs, LPNs, RNs, food service, housekeeping, and administrative roles. And yet the pipeline's broken. Training programs aren't scaling fast enough. Wages, while improving, still lag behind comparable jobs in other sectors. Retention is suffering due to burnout, lack of childcare, and little opportunity for advancement. So the real kicker is that foreign-born workers already make up nearly 25% of the senior care workforce, but immigration policy hasn't kept pace with reality. By limiting access to work visas, we're effectively cutting off one of the most viable paths to meet this labor demand. It's not about politics, it's about people. We can't expand care without caregivers, period. Policy needs to catch up fast. And that means scaling workforce training and credentialing programs, creating pathways for career advancement in care roles, offering tax credits and wage subsidies to retain high-performing staff, and yes, opening up targeted immigration channels to bring in qualified, motivated talent ready to care for our aging population. So, what needs to happen? After our time spent together in DC, here's what we're pushing for. First, a federal tax credit for family caregivers. Next, an expansion on the VA's assisted living pilot so more veterans can choose assisted living over institutional care like skilled nursing. Increase Medicare waiver reimbursements to actually match the cost of providing care. Right now, it's way less. Next, investment incentives for development and staffing, because without infrastructure and people, none of this works. And look, I know what some folks are thinking. Assisted living is private pay. Why should the government get involved? Here's why. They need to get involved, because when assisted living is accessible and affordable, everyone wins. Families stay off Medicaid longer, hospitals reduce readmissions, and most importantly, older adults live in communities that support their health, their autonomy, and their dignity. So we're not just advocating for a sector, we're advocating for a reality check on how we care for our aging population. The public wants choice, operators want support, and policymakers need to understand assisted living is essential infrastructure. If you're an operator, now's the time to get loud. If you're a policymaker, it's time to stop overlooking assisted living in long-term care policy. And if you're in the trenches with us, thank you. The future of aging well depends on what we do next. So that's it for this edition of Breaking Ground Senior Living Now. If this was valuable, subscribe, rate this episode, and please share. It helps more industry pros stay ahead of the curve. I'm Jerry Vinci, CEO of CCR Growth. Thanks for tuning in. See you next time.
That's it for Breaking Ground Senior Living Now, and thanks for tuning in to From Leads to Leases. Let's stay ahead of the curve and keep the conversation going. Visit ccrgrowth.com to learn how we help providers turn challenges into opportunities. See you next time.